made to the nation. America's public enemy number one in the United States is drug abuse.
Nothing mattered but the ever-present craving for the drugs. He had given up interest in everything else.
These are some of the most vulnerable members in our society who are marginalized and are hurting after years of pain, and they deserve our compassion. I don't like to talk about numbers because I think it helps us to forget that these are human beings whose lives are now gone. But to put this into perspective, last year alone, we lost 2,816 people across Canada.
Shame!
That's 8 people every single day with families who will now grieve their losses for a lifetime. This week in Ottawa, we are aware of at least 3 people who have died. And Councillor Fleury, for your information, the majority of these people dying are in your ward. This means they are your constituents and that you have been elected to represent and advocate for them. For the rest of us, and for all of us informed on this matter, we know that the evidence shows that harm reduction saves lives. In BC, there are overdose prevention sites and safe injection sites operating in tandem, and there has not been a single death in any of these facilities. This should speak for itself to show the immense value that it brings to have both of these services offered. We all know that this is a complex crisis which requires a comprehensive and collaborative approach. The pillars necessary to deal with this involve education and harm reduction, treatment and enforcement, and no one strategy will even begin to solve this. We at OPO operate from a place of grief and compassion and love for those who are struggling, and we know the immense value of providing a safe place for people to use drugs. At our site, we not only provide life-saving services to respond to an overdose, but we also show dignity, compassion, and support, and our guests regularly tell us that they have something to look forward to because they know that there is someone there who cares, which they face, and they have said that they are surprised that people actually care whether they live or die. 11 days ago, I was present for an overdose. We saw a young woman come in, and with the next thing we knew, she was unconscious with a needle still in her arm. This young woman is someone's daughter. That day I called 911 and I assisted people in keeping calm while my 2 fellow volunteers saved her life with naloxone and breathing. This was truly the most heroic thing that I've ever had the opportunity to witness, and to know that we saved someone's life is the most valuable thing I can imagine. If Ottawa can save one life, one single life, then it is evident that there is a need for our work in this city. On Tuesday afternoon, the first day of the safe injection site in Ottawa, 1.5 hours into their service operating, there was an overdose at the Sheps 2 blocks away. To me, this indicates that the service, while it is commendable, is unable to meet the growing needs in our city for our vulnerable populations. 2 seats at a temporary site in the downtown core of a city with more than 800,000 people is unacceptable to provide adequate health care as a response to a health crisis.
So my first question is, what is harm reduction to you?
Oh. Well, I don't know if you're going to get the textbook definition of harm reduction out of me.
It's probably for the best.
In what context? Are we talking about, like, drugs and
yes,
substances?
most certainly. That is the context in which I'm referencing.
I think meeting people where they're at and the services they want to use. So harm reduction can mean a lot of different things to a lot of different people. I don't know if there's one static definition that would fit it. There's a bunch of United Nations definitions that sort of fit around, like providing essential services and healthcare and dignity, which we're going to do anyways. But in terms of harm reduction in the city of Ottawa and how I participate in it, is filling in the gaps in services that aren't provided by other providers to be able to ensure people can use safely. Also ensure that if they choose to not continue using substances, is to be able to transition off of them or anything in between that. So, and doing that safely and providing, whether it's supervision, whether it's it's support, emotional support, or financial support, or logistical support, or any of those other things. And those sort of all fit into that framework of harm reduction as well. So basically just making sure if people want to use drugs, it's safer. It's never going to be like 100% safe. But, and if they don't want to use or stop using, that they can do that safely as well.
What kind of gaps are there in the services presented by the City of Ottawa towards people who use these services?
I don't know actually know if I can answer that question if it's going to school without being
Yes.
So Ottawa Overdose Prevention Ottawa, which was set up their site on Cumberland and St. Patrick, which was running from August 31st or thereabouts until last week. Saw 3,000 something visits. So obviously filling a need that a bunch of volunteers that are there present that are preventing overdoses, giving somewhere for someone to use inhalation services, so maybe smoking crack or opiates or opioids in general or any other thing. Currently not available in the city. Overdose Prevention Ottawa is shut down. That has transitioned their supervised injection over to a trailer that's on the Shepherds of Good Hope property. There's no inhalation there. It's supposed to be aimed towards overdoses and sort of very much segmented and viewed the fentanyl and opioid overdose crisis that's going on now as being a health crisis and one that can be contained in that order, sort of separating by services who's using what drugs and what drugs are good to use in certain places and what drugs are bad. So that whole discourse also is probably a gap in that we're operating from the sort of medical model. Dr. Ezra Levy, who's the head of the medical committee or medical board for the City of Ottawa,
My
Public Health.
ex-boyfriend's father.
Oh, lovely.
Yeah.
Ezra's like a lovely man. I don't think he would know who I am, but I've met him a couple times. I don't think I should also call him Ezra. I think Dr. Levy is like probably the proper term. He pointed out today in the media when stepping down that
He's stepping down.
He's stepping down in the summer, I think, or next year. So he pointed out that one of the essential services, like so they pushed for supervised injection being like widely available. And his point is that even with the 3 or 4 that will be opening soon or that are shortly to be open, there's 2 that are currently open, is that it's not providing enough and that anyone that's a medical or agency or social work and has the qualifications to reverse an overdose should be allowed to essentially operate and apply for exemptions for supervised injection.
Maybe some of the stigma that the guests of OPO were facing. Just like a bit of a rundown because I have 2 minutes and 30 seconds.
So, you want to ask me what the line there is. So there's a lot of stigma. It's not only facing the people that are using the site. I think it's generally people who use drugs in general. And I think we like to draw a line in the sand that the people that are using OPO and that were using the services, they're the most visible part.